Hello, fellow Henry Countyans, as well as the surrounding counties that tune in to us. And thank you for joining us again today to give you an update about our facility and things that are going on from a healthcare standpoint. First off, I do want to remind everyone that we continue to have a masking mandate in the hospital. So please do remember to bring your mask with you to wear those inside the hospital. So thank you so much for remembering that and doing that for us. So let's move on to what's going on with healthcare today. Yes, I know everybody's tired or overwhelmed with all the COVID information, but I think that you all like to hear what's happening right here locally. Well, the state of Tennessee has seen an increase since the beginning of July in COVID cases. The Tennessee Health Department says 97% of the new COVID cases are among those who are not vaccinated. When we look at the health department information as of July 21st, 36.7% of Henry Countyans are vaccinated, 41.3% of our state are vaccinated, and rural communities continue to just struggle with being vaccinated and information out there. We're starting a campaign of getting factual information out to folks. So there'll be more coming out in our community. If you need something, please reach out to us. Join us on our website, join us on our Facebook post, any of our platforms and the information that we send out through various media. Please know that that's the science behind the information, and we're sending that out to you so that you can be well informed. When we look at statistics for Henry County, our positivity rate has increased to a 13.7% positivity rate. We have been averaging 2 to 4 patients per day over the last month. Today we're at 6 positive inpatients. 3 of those are in our critical care unit and 3 are on our regular floor. No one is on a respirator at this point. But again, that just seeing that increase, and I'm hearing that from my fellow hospital folks as well, that they have an increase in COVID cases in their facility. So we are seeing that ramp up. So again, just wanted you to know that we're watching and monitoring this, and just be aware of what's going on in the community. Secondly, I'd like to talk about the state of the hospital. Where are we? Let's talk about jobs. We have over 50 openings in the hospital with jobs. I'm sure there's lots of places throughout our community that have job openings. We recently joined in a job fair for our community and found that lots of people have openings. So again, we have just over 50. We employ over 800 people. So that's a big gap for us to have such an opening. These are anywhere from RNs, CRNAs, food service, environmental services, maintenance, HVAC specific, and just also know that we are working towards recruiting a general surgeon. That's one of our top recruiting areas from a physician standpoint. And then just as I mentioned, all of those openings, some of those that I mentioned for RNs, CRNAs, food service, environmental services, and maintenance are some of our top areas with openings also. If you would like a job with us, please come check us out and talk with us. Or if you know someone, please pass that along. What's happening in the healthcare industry that's causing such an opening? Let's look and take a dive into RNs for a moment. When I researched and looked through information, there's 129,000 job openings nationally for RNs. That's 31% higher demand than pre-COVID days. Also, there are 21,000 openings for travel nurses. Pre-COVID days, there were like 8,000 travel nurses. So now there are 21,000 openings where there are 23,000 already employed in the travel industry. So lots of things that are changing. The travel industry is changing how we look at our workforce. Another area that's changing how we look at our workforce is the tech industry. Just looking at Nashville alone, there's several tech industries that have moved into there. leading to different healthcare jobs and how people work in different roles. And I saw an article about Oracle, who is a healthcare software company that will be investing $1.2 billion into Nashville to build and relocate to Nashville and offer close to 8,500 direct employed jobs, with a significant number of spin-off jobs from that. So as I've told my staff, our competition isn't just the local market and also the surrounding healthcare facilities. It's also become the United States, and if we take it a step further, it's globally, because now you can work from home with your computer doing various things in the healthcare role. So it truly is a new dynamic day when it comes to hiring folks. It's not just post a position and receive applications. That's not the paradigm today. So again, we have some openings, and we're working towards filling those. Also, we had a meeting last night with our board of trustees, and we asked Senator John Stevens to join us, and it was quite exciting. Not only did Senator John Stevens join us, but several of our medical students from LMU joined us last night and talked about why they are here, all the different places they're from, and how excited that they are to be here in our rural environment and learning firsthand experiences of healthcare. They get to work directly with a physician and learn rural healthcare, and they are tomorrow's doctors. We are working towards standing up a residency program here in Henry County. Last spring, we graduated 8 physicians. It's called a white coat session. It's the first time that we've ever had such a session, and it was remarkable to attend and watch these 8 medical students finish their program and receive a doctor white coat. Many of our physicians attended that and actually were their mentors and passed on the white coat to them. Again, very exciting. And what the state has done for funding in these residency programs, we're excited about that too, that they are sponsoring this as a workforce development to sponsor residents in a rural area. So we're so thankful that Senator Stevens met with us and discussed all of that and worked through the state to move that forward. And there will be 3 rural residency programs to roll out with the state, that the state is offering for that. And so we're excited that that happened, and wanted you to know that and how exciting it is. This is our first ever to have such a growth in our community to truly grow doctors for tomorrow for rural health care. So we're so excited about that. Also, what else is going on at the hospital? We are continuing our assessments with behavioral health. We've heard from you, the community, on the needs for behavioral health. We spent the entire month of April working with a cross-section of our community, talking about rural health care needs and looking through all the things that are available here. And for the whole month of May, did a campaign out to inform people of mental health and the needs of mental health, as well as all of the different services available in our community. We have booklets that we handed out at grocery stores, in offices, and all across town to tell you about the things that are available to you. And then secondly, we are working on the need for filling the gap on counseling services. So we've taken that upon ourselves to grow a outpatient counseling service. So stay tuned with us to learn more about that. And we hope to launch something in preparation for September, which is Suicide Prevention Month. So we hope to tie in right with that, with counseling services for that. So again, we've heard from you as a community about behavioral health needs, and we'll continue working on that. We've also met with St. Thomas. Many of you know that we work with them for a cardiology program, and our full-time cardiologist that's been here for about a year and a half has left us to go and work for the VA. And St. Thomas is committed to recruiting another full-time cardiologist for our community. And hopefully we'll have someone here shortly. Those cardiologists that were coming 1 day a week to 2 days a week will still be coming. So again, this is just adding on the additional services there. And we look forward to finding that person and having them back in our community. So stay tuned for that as well. And we're so glad that St. Thomas continues to promote our community and fill those needs with us. Lastly, I've got some upcoming events to tell you about. August is immunization month, so you'll hear from us on different immunizations that are offered for your safety. And so we'll have information coming out about that. September, I mentioned, is Suicide Prevention Month, and we'll take another deep dive into behavioral health and the services that are offered around that in our community in September. Also, September 22nd is our service awards for those that are long-term here in our facility. We recognize people who've been here 5 years and greater, and it's amazing and always a tribute to know the multitudes of our staff that have been here longer than 20 years, all the way up to 30, 35, and 40 years that staff have been dedicated and here. So we will have information out to honor those folks who are committed to us as an organization and you as a community. Also on September 24th, Henry County Medical Center will be sponsoring the Patriots game, the Patriots versus South Gibson at the football game. So we'll see you there for a tailgating night and lots of things that we can do together. And then October 23rd is our Healthcare Foundation Casino Night. The Healthcare Foundation has taken upon themselves to assist with our behavioral health needs, and the funds that they raise, the tickets that they sell and the funds that they raise will go to refurbish a counseling room at Paris Pediatrics. So we're looking forward to having something for our youth and our pediatric groups that attend there and have that available. So again, join us on all those events. Stay tuned to us, and thank you for joining us. We so appreciate you and are glad that we can serve our community. Have a wonderful day. Thank you.